With us right now, we have Lee Isley, who's the President and CEO of the UNC Nash Health Systems. Welcome.
Welcome. Thank you, Mayor.
Yes. So, this has obviously been a crazy time with C-19 changing daily what we're doing and anticipating going into really the worst 2 or 3 weeks, next 2 or 3 weeks of the process and infection and working through the inventories and skills that we have. Anything you want to share with us on that, just in an overview, and then we can get down into some of the specifics?
I think what certainly I want the citizens of the Twin Counties to know in Rocky Mount is that they have a staff at the hospital that's working very hard, is extremely focused on the mission at hand.
Sure.
Which is taking care of our patients who have all medical needs, but certainly over the last several weeks, we've been focused on COVID-19 and making sure that we remain safe and that we take good care of those individuals who are testing positive and are dealing with this disease.
Sure. Well, tell us about some of the protocols you guys have had to put in place to obviously protect your staff,
Sure.
Our patients, and those of the general community too, because going into a hospital is not exactly a germ-free experience.
Sure. So we have limited some of our entrances,
Okay.
and most of our public entrances are still open, but they do now have attendants that are sitting and are monitoring visitors, our staff, and vendors as they come in.
Sure.
And asking a series of 5 questions around upper respiratory disease, fever, flu-like symptoms, and if an individual answers those questions, and certainly we advocate that in an honest way, the staff may elect to do a temperature check and then help direct that individual for the best safety of themselves and the rest of our patient population and staff. And so that's just one of the measures. As you may have read, we have limited visitations. So recently we changed, and individuals who are on isolation precautions,
Right.
Either droplets or contact, are not allowed to have visitors. That's really 2 reasons. One, for their protection and the staff's protection. The second is preservation of our personal protective equipment.
Right.
And so anyone that goes into those rooms have to wear the same PPE that any of the providers would wear. And so we're trying to preserve that. We have put in some measures through the electronics, and we have virtual visitations through FaceTime that would allow family members and the patient to keep in contact with each other. All the nursing supervisors on the floor know how to access that, and so if a patient asks or a family member calls, we can make that connection for the family.
Sure. Yeah, I'll say you guys have done a remarkable job, at least in my experience, outside looking in, as well as conversations with you and others in the medical staff. And I've noticed that in Nash County, we're up to about 22 cases, I think it is. Edgecombe County is significantly lower than that. The spread doesn't seem to be as significant as it has been in other parts of the state. What do you attribute that to?
Well, I think that we are doing a really good job of social distancing, staying at home.
Right.
And we're seeing that through our volumes. Our volumes in the emergency department, through imaging, surgery, all those different areas are decreased.
Right.
And as we're getting around in the town and doing the necessary work that we have to do, we're seeing less people. And I think that's really making a significant difference.
And I've seen that too. I mean, surprisingly enough, a lot of people want a curfew. And I've felt some significant pressure putting curfew in place. And I've driven around town. I've been to every basketball court during the course of a weekend 3-4 times. People seem to be really listening and paying attention and trying not to congregate in too large of a group. And that's what I'm seeing. So I'm encouraged to hear that your ER volumes are certainly speaking to that, or at least demonstrating that.
Sure.
The other thing I think is important too, as I understand it, there have been a number of hotel properties and companies in town that have allowed or are offering up opportunities for medical personnel to self-quarantine themselves from their family while they serve the public at UNC Nash system. I don't know if you want to speak to that a little bit, but I think that's a great collaborative effort.
Sure. Well, the community has been very generous. Everything from offering discounts on hotel rooms for our staff who decide to self-isolate from their families because there may be a high-risk member in the house. And of course, as a healthcare provider, we're always on the front lines of having contact or possible contact with a COVID-19 patient. And so it's just been generous and overwhelming. The PPE donations have been very generous and have been very helpful to us. We've been spending a lot of energy on a daily basis securing our supply chain to make sure that we have the adequate PPE needs for today. Next week, one of the most unique things about this event is that the timeline continuum has really changed. And if you look back, it's really only about 3 weeks.
That's right.
But I promise if you were to ask a healthcare worker, it seems like we've been in this for months or perhaps almost our entire career have been dealing with this. And so it certainly is.
And you raise a great point. Dr. Cohen came out from the Department of Health and Human Services yesterday in a press conference and suggested that perhaps the models, this thing's not going to be over April 30, right? So, I mean, we need to talk about that. I mean, it's not like it's an event that's come and done. All we're really doing is kind of flatlining the infection rate, slowing it down so that we're not stripping out of our resources. But we have to anticipate this is going to be with us for a little bit. So you want to talk about that a little bit?
Yeah.
Of course, and she was mentioning some models that they had run, but I think you're probably more knowledgeable on those matters to probably speak to it.
Yeah, there are numerous models out there,
Right.
And we are certainly working with the state health department, our local health departments, both in Nash and Edgecombe County, looking at the curve and looking at the models. We've also been working with UNC directly, and our epidemiologists there in Chapel Hill through the university, and are looking at our models. Nationally, if you're watching, Dr. Adams is telling us to expect a hard and difficult week, and I would really think that most of us in the healthcare environment are really preparing for several difficult weeks. And social distancing and self-isolation is going to be so important for us as we move forward. I read an article here this morning that if we continue to be diligent, that we are about a 25% chance that we would surpass our supply of hospital beds, ventilators, and critical care capacity in North Carolina. If we relax our social distancing and start gathering again, that goes up to about 50 to 60% chance that we would outstrip the supply. And so it's really important that we remember and stay focused on staying safe, our hygiene, our hand hygiene, washing our hands, social distancing, and self-isolation, and self-monitoring for those symptoms that we know are associated with COVID-19.
Right. So I think it's one thing to probably prepare our audience a little bit for maybe an extension of some of these quarantines, if not exactly as we've been demonstrated or experienced it at some level. It's just simply not going to go away. That C-19 is here unfortunately, for a little while.
It is, and we're actually seeing projections into the first week or 2 weeks of May.
Right.
And we expect to be working and delivering care for COVID-19 patients well into May as we continue to move forward. And it really we're going to get some good news. And many of us have been self-isolated for quite some time, and we're going to have the urge to run out and celebrate and be with our friends and family. And we really need to be diligent and thoughtful about how we're interacting until we are confident that we have this disease and this process under control.
Right. Look, I appreciate you coming on. Is there anything else you'd like to share with us that you think that maybe we need to be cognizant of or thinking about and maybe being proactive on?
Well, obviously, we're continuously updating our website with COVID-19 information. You can always go to our website to get the most up-to-date information. We are daily meeting about the number of inpatients, outpatients, and the resources that we have available. The community needs to know that we're preparing for surge capacity that would take us outside of our normal bed capacity.
I think we are grateful. I think we are, it's a wonderful asset that we have for this community. I think everything that you guys have done has been fantastic. It does raise one additional question though, because when you start looking at health resources and the number of beds available throughout the state, a number of hospital systems of significant size have laid off a number of nurses, and really is my understanding that's really to create capacity. It's really more about voluntary surgery, elective surgeries, to be able to anticipate a big surge. But the two might seem to be mixed signals or mixed messaging. And so I think it's probably a good opportunity if you could really speak to that maybe folks would understand a little bit better.
Yeah, so we are struggling
Sure.
as a management leadership with the board about how to ensure that we keep our staff, protect our staff and their salaries and their livelihood, keep them connected to the organization while being financially good stewards through the downturn of the volume. We have postponed elective surgeries, and elective surgeries are simply those procedures that don't immediately put the individual at harm or long-term ill effects. Now, that doesn't mean that there's not pain or discomfort associated with that. Different examples would be a polyp removal is an elective surgery, cataract surgery is an elective surgery. So they're needed. There's just that in the next 30 to 60 days, there aren't going to be long-term ill effects from delaying that. And so we have done that. That's mostly for blood preservation, so that we make sure we have a blood supply, and also PPE, and that we don't endanger or bring individuals in contact with COVID-19 unnecessarily. So those are the measures for doing that. We want to get back to doing elective cases as soon as we possibly can, and I promise Rocky Mountain in this area that as soon as it's safe, we will certainly be back doing those procedures again. And I think the other thing that's important is that you often read throughout the state of North Carolina that hospitals and healthcare systems are often struggling cash flow. Days cash on hand is often a topic. And I want to really give the credit to the board for their vision for ensuring that we have the cash reserves to be able to weather this, so that when this is over with, we have a strong financial viable organization that we can continue to rebuild on and continue to serve the community. And I guess the last I would ask is, if you know a healthcare worker, just thank them for what they're doing.
Absolutely.
And let them know that you're supporting them.
Thank you so much, Dr. Isley, for coming, and we want to thank you. We appreciate you as a resource and the hospital for all that it's been and continues to be.
Well, thank you very much, Mayor.